Joint hypermobility syndrome and Ehlers-Danlos syndrome is a connective tissue disorder, a genetic problem or issue, if you like, that runs in families, of course, because it's genetic. Your connective tissue is everything in the body, pretty much. So your skin, your ligaments, your tendons, your muscles, your blood, all the muscles of the body. So you have skeletal muscle, which moves you and stabilizes joints. You have smooth muscle, which is in your gut and affects your digestive system, or your digestive system is made of smooth muscle. And also you have vascular muscle, which is your heart and blood vessels. And they're all affected by this connective tissue disorder called joint hypermobility or Ehlers-Danlos. And we see it most in the joints. Obviously, the superficial level, we see people being bendy, contortionists, if you like, okay? And the reason that their joints are bendier than, say, our joints are because the ligaments in our joints that join bone to bone are normally tough and strong, and they limit the movement of the joint, okay? And then the muscles cross those joints, and then the muscles work and they move the joints. But in connective tissue disorders, the ligaments are stretchier, okay? And the ligaments are made of collagen, and that collagen is deformed in this genetic disease, so it's stretchier rather than tough and strong. And as you know, collagen's in the skin. So people with hypermobility, their skin is stretchier, and it's so much stretchier that actually they tend to look younger for much, much longer. Just like you take your collagen to try and make yourself look younger, these people don't need to do that because they look younger. They get an ID'd when they're 40 years old. Yeah, it's a very interesting effect. It affects everything. So when you're looking at someone and they say, I've got hypermobility, it's not just about bendy joints. And we're going to talk a little bit more about how it affects the whole body in the next video.